Hello and welcome to this panel discussion titled Women in Asia and the Challenge of Mental Health. I am Manoj Chandran, founding CEO of India-based non-for-profit organization called White Swan Foundation. For the last 7 years, we have been working in the space of mental health, delivering knowledge that has helped millions make informed decisions on the subject. I'm delighted today to be part of this leading workplace mental health conference. This can happen. I'm honored to be invited to be a part of the Asian Advisory Board for this conference too. I'm also particularly excited to be a part of the Asian program curated by our long-standing partner, Community Business. In the context of workplace, the focus on employee mental health is gaining momentum, certainly, even as we in India are witnessing a positive, though slow, trend of gender equality at workplace. The gender sensitization among employees, mental health issues among women at workplace is not yet fully understood. There are several layers of complexities to it. Recognizing that Asia is a vast and diverse region, we are going to focus today particularly on the markets of India and Japan. However, many aspects of this subject, I believe, will resonate in other parts of the region. It's my privilege to moderate this session today in the presence of a distinguished panel of experts. Let me now introduce our panel members to you. Suzanne Price, Representative Director of Price Global, is a consultant and coach with expertise in diversity, equity, and inclusion, psychological wellness, and emotional intelligence. Suzanne is a qualified mental health professional. Dr. Prabha Chandra is a professor of psychiatry at the National Institute of Mental Health and Neurosciences, NIMHANS at Bangalore, India. Dr. Prabha was the architect of India's first perinatal psychiatry unit and is the president-elect of International Association for Women's Mental Health. Jaya Virwani leads the Diversity and Inclusiveness Agenda and the Ethics Office for EY's Global Delivery Services. She's based in Bombay and Bangalore. Welcome, Suzanne, Dr. Prabha, and Jaya. Before I begin a housekeeping announcement, during the session, should you have questions for the panel members, please place them on the chat box. We shall certainly take them up at the end of the discussion. So let's dive right into the discussion. And we would want to start by laying down a few statistics here to understand the severity of the issue and the topic. Dr. Prabha, I would want to start with you. Dr. Prabha, if you could please share some data on the prevalence of mental health issues among women, particularly at workplaces. If it could be a global, in the global context, it will be even better, actually. Thank you.
Thank you, Manoj, and I'm so delighted to be part of this panel. Interestingly, the fact that women work is actually good for their mental health. So it has been shown by repeated studies and prevalence data that actually work is a very good thing for women and for the mental health of women, and they actually feel better when they're working. Having said that, among women who work, there are obviously lots of conflicts and lots of problems that they face. The sort of oft-repeated 1 in 5 people having mental health problems around the world is probably true for women at work also. But what we find, while the general prevalence may be very similar, there are differences in between countries in different types of work. So certain types of work are more stressful and women have more mental health problems there. Certain types of work are less stressful. So I think we need to qualify that. And what is very interesting is that studies which have been done globally, for example, comparing a Scandinavian country like Finland to countries like Japan, Singapore, other Asian countries, including India, have found that in countries where gender equity is less, the work-related problems are actually heightened. So I think it's very important to understand the context in which you are looking at women in workplace. Secondly, workplaces where women have less control or have less of a voice, or they are not part of decision-making bodies. In those situations, women have more mental health problems or more stress. So I think, to my mind, more important than the prevalence, the percentages, what is important is the context and the nature of mental health problems. So a lot of women in workplaces which are, like I said, which are stressful, where women do not find their voice, where there is inequity, conditions like a lot of psychosomatic illnesses, anxiety, pain, sleep disorders, and of course, the more sort of common depression and anxiety. These are the kind of conditions which are found, quite commonly. So I would like to lay the whole context in which we're talking about mental health in the workplace.
Thank you, Dr. Prabha. That really helps us understand the severity and the extent to which the problem really exists, particularly in the region. Jaya, you had the diversity inclusion in an organization. How do you see this data really reflecting in the organization? And do leaders really get to see this in front of them?
Thank you, Dr. Prabha. And Manoj, that's a great question. And I just wanted to highlight a recent study. And this was a LinkedIn Workforce Confidence Index report, which had about 2,254 professionals respond to it. And this was as recent as September. 46% of the women that were surveyed work late to make up for work. 44% are working outside of business hours to provide childcare. And 42% are unable to focus on work with children at home. So, the disproportionate burden of childcare, of, taking care of your family or elder care responsibilities, and then household chores, all of this has doubled or tripled with the pandemic. And that is a very relevant discussion today. Also, if I look at how conscious are we of the changing dynamic, we started the conversation on wellness, on mental health awareness, all of this 3 years ago. So it wasn't a result only of the current situation that we're facing. So we were much more aware of it early on, and we have worked towards making the conversation safe, having support systems within the organization so that women can really manage their work and life in a more effective manner. And this was, again, like I say, a 3-year-old conversation. And of course, today we've done much more than we did even 3 years ago in this space.
Thank you, Jaya. I think it's great to know that organizations are beginning to recognize this. I think it's time for us to really get into what are the causes here. And, environment and mental health professionals pointed about the impact of environment on mental health. So be it social, economic, or physical is a key trigger for our mental health issue. It is also the reason what we do about mental health. So Suzanne, in your experience in Asia, particularly Japan, what are the key characteristics of a woman's daily life that make them more vulnerable to mental health issues?
Thank you, Manoj. I'd like to add on to some of the points already raised by Dr. Prabha. One of the things in Japan, and I think it's true for a few other countries within Asia, but very strong in Japan, is they have very strong gender roles. And so what that means is that women shoulder all of the family responsibilities. So whether that's children, whether that's domestic responsibilities related to keeping the home, and also a lot of the elder care responsibilities. And so one of the challenges for women is how do they balance out all of those different priorities? There's some research that says that the average Japanese man does 20 minutes of housework per week. So not a lot of help there. And compared with some other countries within Asia Pacific, domestic help is very expensive in Japan. So it's culturally not so common, not so widely accepted, and it would be expensive for a lot of people. So what we find is that women are trying to juggle too much at home as well as in the workplace. They end up feeling guilty towards their colleagues because they need to leave work, not work excessive hours, not work the overtime because they need to get to the childcare facilities before they close. And then on top of that, they feel guilty towards their family because there's pressure from their own parents and their parents-in-law that women used to stay at home. And so if their child gets sick, then they get some grief from others in their family. It's your fault your child is sick. It's because you're not home as a mother all of the time. So they're carrying quite a lot of that pressure. On top of that, again, I think it connects very nicely with what Dr. Prabha had to say, this sense of no choice. So women in Japan often feel that they need to choose work or home, and they don't feel that if they choose both, then that's their hardship to bear. And on top of that, they don't have the skills to have discussions at home with their partners about how do we share parental responsibilities and domestic responsibilities. And I'll just add one more thing, a cultural aspect of Japan is a sense of gaman. And gaman means that you're kind of stoic, you don't show your pressure or your stress. So there's a tendency to bottle up a lot of stress, not share it with others.
Thank you, Suzanne. I think that really lists out very nicely about the social, cultural kind of dynamics around which women have to handle their life, particularly from the perspective of emotional health. Yeah, if there is any input you will have from an Indian context, how do you view this? And if there is any additional pressure or any additional kind of scenario that breaks out for women in India?
Yeah, Manoj, great question. And I think just going back to all the points Suzanne highlighted, very similar context in India as well. The only difference is the help that you receive in terms of household help is, not as expensive as it would be in Japan. But given the current scenario that we find ourselves in, again, not being able to give 100% at work and not being able to give you 100% at home, that guilt and that burnout and stress is also something that we have to factor and think about. If I look at the joint family system in India, so you have then, the expectations from all of the members and conditioning growing up in India, it's always to put yourself last or your needs last. So self-care as a conversation is not something that is on the forefront and that you can actually have saying, I haven't had any time for myself. So that's a tough one, I believe. Also, then if you have nuclear families, you're moving away from your hometown and you're coming away into a bigger city to work, that has its own complications because then you don't have a support system. So especially if you're moving with your children and away from your parents or your in-laws, then you're managing all of that by yourself. So I think that the other aspect that again I wanted to highlight is home not being a safe space really for some people. And that's another one to consider because the assumption is that, home is your space where you feel okay and safe. And it may not be true for some women. So here's where organizations come in and they can provide the support that women need. Because I think if you don't have support in the household and if you don't have organizational support, you're going to drop out of the workforce. But if you have either or, you're going to stay. I think these are the essential points that we really need to highlight via this conversation.
Thank you, Jaya. I think you and Suzanne have really articulated well the kind of life of a woman in Asia. Dr. Ba, I think it will be interesting for us to understand the implications on the mental health of the women, given the kind of situations they live in. And there is also this whole belief, that we're talking about social and cultural environment which are age old. And why are we suddenly talking about mental health implications around a certain culture, which is not new? So it will be really interesting to get your views about do such long periods of situations, stressful situations, lead to trauma, and how do they manifest into mental health issues?
Thanks, Manoj. I think that's a great point that you raised. And the whole sort of concept of trauma, I think, is extremely important because when you think of trauma, you only think of something which is acute, like an accident or a surgery or something life-threatening. But trauma can be actually something which keeps happening low-key on a day-to-day basis, microtrauma. There's a lot of conversation around that. And I do want to emphasize what, Suzanne and Jaya have said, and that you're expecting women to do non-traditional work in cultures with traditional ideologies, and that's a real sort of and how do you even come to terms with that? So at workplaces, in corporate sector, or in high profile jobs, you're expecting women to actually take on very non-traditional kind of work roles, and then when they go home or even step out or even within the office, they have traditional roles, which means basically not speak up, and all the other things that are expected traditionally. And I think that causes a lot of dissonance and can be traumatic. The second thing is about rewards. I think it's very important for women to be able to get rewards and to be able to accept rewards. And many times things are taken for granted from women, and nobody recognizes their journey or all the difficulties that they're going through, and there are not enough rewards, be it financial, where there's a difference in pay, and there's a gender pay gap, or there is a difference even in the kind of promotions they get, the fact that they have to take maternity leave. So I think these are the kind of things which are day-to-day trauma. And of course, I think like Jaya mentioned, like you have an unsafe space at home, you might have an unsafe space at work. So we're talking about sexual harassment, gender discrimination, and those little barbs that a woman might get at the workplace on a day-to-day basis. And continuous trauma of this kind is known to interact in the brain, affect brain areas, and cause poor emotional regulation, anger, stress, and a whole range of psychosomatic problems. So it might happen that a male colleague will say, "Oh, I never said anything. It wasn't meant to be, a criticism," and she's overreacting. But I think one must recognize that the overreaction is related to a very sensitized nervous brain system, which has been going through microtrauma on a day-to-day basis, which has been handling the fight and flight kind of reactions on a day-to-day basis. And what you see is a cumulative kind of effect of that trauma. So that's what I'd like to highlight.
Thank you so much, Dr. I think that's a very interesting word, microtrauma. And I think it's extremely important for people around them, around those who are at risk, to be able to recognize the potential and say that the trauma is not about one-time incidents or situation, but it's slowly building up, and there is something that we all have to do about it. Let's move on to the next part of our discussion, which is about the current situation. And it is imperative that we discuss the topic in the context of the pandemic, which has put the world through an unprecedented situation that we have never been trained to deal with. One of the biggest effects of the pandemic is an increase in mental health issues, particularly among the vulnerable. In India, it is believed that cases of domestic violence have risen during the lockdown. How did the pandemic impact the emotional health of women in Asia? Let's find out. I'd like to start with you, Suzanne. Since you have done some research in this space, could you highlight and throw some light on how the pandemic has impacted mental health of the women, particularly working women?
Sure. I'll share just a few very high-level statistics that I was able to unearth. And one is that in Japan, since March, this is for men and women, the use of hotlines has increased by 50%. And I'd be interested to find out from organizations that have an EAP in place, an employee assistance program, whether there's an increase in take-up of that service as well. Then looking particularly at gender, within Japan, the latest stats I can get on suicide goes up to August. And in August, the suicide rates had increased by 15.4%. However, the suicide rates for women alone were up 40%. So impacting women more than impacting men. Some other statistics that I think point to why women are feeling more of the stress. In Japan, a lot of women are in the retail and services industries. About 66% of the people who work in those industries are women. A lot of the people working in those industries are employed as contract workers as opposed to permanent employees. In Japan, there are very, very strong labor laws, and so it's very difficult to lay off anybody that's a permanent employee. However, contract workers can have their hours cut back and they can be dropped fairly easily, simply don't renew or discontinue the contract. And so more women are experiencing a sense of job insecurity at this time, or they've already lost their jobs. So that's one of the other factors I think at this time that's contributing to more women feeling the stress around COVID-19. Some of the other things that are impacting, I think some of you others have also mentioned, Japanese homes are small, especially in the cities, Osaka, Tokyo, where a lot of the workers are. The homes are very small. There is not a specific room that would be the home office. And so you've got perhaps children home from school and perhaps two people trying to work from home, all in a very small confined space. So finding the space to be able to do that is really difficult. And what we hear from women is one of the key things that they want is a space away from home and that's COVID safe. So they also worry about, well, if they go to another space, then there's crowds or there's other people there, or they have to take crowded transport, and then that would stress them out too. So I think that's one of the other difficulties for them. And then on top of that, of course, if they have children at home or elders to take care of, they're shouldering more of that kind of responsibility. There's been a few jokes that have come up in Japan around the fact that since quite a few men have been staying home, a few dads have been staying home, that dads are happy because they're having more time with their kids and they get to enjoy being, weekend dad 7 days a week. The women are less and less happy because they feel like they're having to wait hand on foot on everybody and somehow pull off all of their work at the same time.
Thank you, Suzanne. And yes, same situation, different experience. I think the pandemic really has brought up, I think our unpreparedness, the lack of preparedness for adversities, and there is a lot we have to do about it. Jaya, from your experience at EY, how have you seen in the last 7-8 months, how have women been reporting about the impact of the pandemic on their mental health?
Good question. And I wanted to go back to Suzanne's point a little bit, on the employee assistance program. We saw a peak in July. This is when the pandemic was also at its peak. We saw a peak in July in terms of women reaching out to the employee assistance program for mental wellness and health related issues versus marriage or childcare, or the typical sort of responses that you may hear. And I do believe that number has reduced over the next, maybe, if you look at September, or if you look at the following months, that number has come down, but it did have its peak in July. Also, if I look at the home situation, and if I look at, our responses, and I just wanted to quickly highlight that the hours have become blurred, and there is a need or a requirement that people are feeling to be switched on at all times. So, 24/7, you are expected to be, you're not expected to be on, but I think that's a pressure that you're putting on yourself, that I always have to be on, because you're juggling so much more throughout the day. I also feel like the support system of school has stopped. So, you're helping your children through online classes that they've never been exposed to, which is an additional burden, just making sure that they're attending those classes. And I hear so many of my women friends who have young kids saying that every time I peep in to see if my child is actually attending that online class, they're either switched off their laptop, or they're sitting under their desk, or they've run away somewhere. So, these are the things that they're managing. These are the stories that we're hearing. I also think sleep, we don't consider the importance of sleep, and especially as Indian women, you're waking up much earlier just to make sure that you're having 3 hot meals set in the day. And I had a colleague, that was working with us, an American colleague, and she was here on secondment, and she says the best thing that could happen to Indian women is they just put a box of cereal on the table for breakfast versus making a hot meal. So there are a lot of, these stories that we're hearing. The situation is definitely exacerbated, and there is an additional burden on our women. So we really have to make sure that as a workplace, we're providing much more support than we would have otherwise in a normal situation.
Thank you, Jaya. Dr. Bai, your institution, NIMHANS, has been offering services even during the pandemic, peak of the pandemic, in fact. What has changed during the last 7 to 8 months in women reporting about mental health issues in your hospital? How has the pandemic impacted those who have been under your care actually already with a history of mental health issues? If we could understand that a little better, Dr. Ba.
Thanks, Manoj. I think what has happened was I think the landscape has been changing. So it's 6 months, and we know that with the lockdown there was a different response when lockdown lifted, and then I think people kind of got used to things, and and now it's just going on and on with no end in sight. So again, stress is increasing. So I like to look at it as what was, what is, and what is it going to be like. And I think each of these has had different mental health responses from women. What was interesting was that the ministry, the government in India asked us to start a helpline. And we started a helpline very, very soon in the pandemic. And you will be surprised, we got 10,000 calls in a week. And what was interesting was a large proportion was by women. And so what we did was that we decided to have different numbers for women, children, and the elderly, because we realized that the needs were very, very unique. And the people who are handling the helpline at number 4, which was the women's number, actually got a whole range of very different and very unusual kind of requests, need for help, which was a lot related to what Suzanne and Jaya have said about, work pressure, role conflicts, fears about their children and their elderly parents getting infected. So initially I think it was those kind of responses. Then we got a dip, interestingly, because I think the human brain is very resilient. It kind of adapts itself to newer challenges, and the women adapted to newer challenges. And now again, when people have heard that things are going to be closed till June possibly next year, when none of the festivals are being celebrated, when the normal rituals of family life, which keep everybody nurtured mentally, psychologically, are sort of completely awry. What's happening is, again, we're finding a resurgence. So I think there's been like phases, and I expect now that with things with Europe getting locked down again, with newer infections coming in different parts of the country, there's going to be again an increase, and this time it's going to be like burnout. Because initially there was this surge of energy and said, we'll face it, we'll do this. And then there was a little bit of complacency. Yeah, we've learned how to manage this new normal. And now it seems that it's going to be endless, and it's going to keep happening again and again. And I think the levels of stress are really increasing. And we've had to switch on to online mode of therapy. And I think that is another challenge, not just for the women who seek help, but also for the therapists, because the novelty is wearing off. We recognize that there's only so much sometimes that we can do online, and that we are not trained in online therapies and online treatments. Zoom gets to all of us. So, and sometimes when things like domestic violence, confidentiality issues, we are not able to discuss it over the phone or online because of fear of somebody listening in. So I think these are the kind of challenges, and these are the kind of problems that we've gone through. And I think this is going to kind of go up and down a little bit. And we do, in our training of our young doctors, in the way we do therapies, in the way we do treatments, we really have to kind of relook at the whole space. So many women have said, we want to just come and see you. We just want to come to that therapist's office and sit there for half an hour without having to worry about who's at the door and who's going to call and things like that. So I think that it's a very different landscape that we are all navigating.
Thank you, Dr. Abha. I think yes, I mean, vaccination is absolutely important, but it's very equally important to understand the emotional, the ramification of the pandemic on our mental health, and soon address that through various means. So I think we are also coming to the close of our discussion, and before we leave, we really want to address the solution space. I mean, we've spoken about the problem and what are the basic causes for those problems. I think it's important to understand where do the solutions lie, particularly from the workplace perspective. I think I'm going to start with Suzanne, because you've been working with a lot of companies and training their staff. Do you believe that stakeholders such as co-workers and managers can be skilled to play their role in a constructive manner? And what are those some of those skills, Suzanne?
Yes, thanks for asking, Manoj. And yes, absolutely, they can. And it requires investment of time, a little bit of guts, and of course, a little bit of money. Uh, it's not unusual for organizations to have workshops around stress management, building resilience, etc. And we certainly do a lot of that with people in general. And I would encourage that to continue. I think what makes a major difference is when we step in and provide sessions for managers and for people in HR, and training them to have courageous conversations around mental health. Uh, and I think that, you know, the kind of comfort zone for a lot of people in corporates particularly is to look at scenarios and analyze what we should do in this situation. And I believe that what's more important is to actually practice having those conversations. And so helping people understand a little bit around what are some of the triggers leading to stress for people that are working with them, and then some of the key steps and emotional intelligence needed to start to have that conversation without, you know, overstepping any territory, you know, being a therapist when you're not. I think equipping people with those skills and having scenarios where they actually role play and practice those conversations, that gives people the confidence that they can actually go ahead and do that. And yeah, I think it's not that useful if people just conceptually understand, but they don't really feel equipped to go ahead and do it. So I think that's really one of the most important things. And of course, it does take some investment.
Thank you, Suzanne. I'm also particularly interested in the role leaders need to play in bringing in a transformation, because essentially we're talking about a transformation here, you know, but if you look at workplace as a community, Dr. Prabha, in your view, what kind of a role can leaders take in identifying and applying, executing solutions, particularly from a women and mental health perspective in organizations?
I think it's very important to take on what Susan said, to provide psychological safety. A workplace should feel psychologically safe, which means a woman should be a woman or a man, but you know, here we're talking about women, should be able to say, I am not feeling all right. I need a, you know, I need a mental health day off. Or I'm just completely stressed out. I need to be able to share things with someone. So I think just to be able to give that, and not to feel judged or be thought of as somebody weak, would be the priority for leaders, and which means that the leaders need to recognize that this is a problem. This can have an impact on productivity. It can have an impact not just on productivity, but the general well-being of the whole team and the whole organization, and why it is important to invest. So I think leadership should sort of, you know, create a space which feels psychologically safe. I also think that the messaging should be that the threshold for talking about your emotional problems can be lowered at this time. So usually we say, oh, you know, only when things get really bad, you should go and talk to somebody senior. But I think you should just be able to say, you know, don't worry. It may seem very innocuous. It may not be anything, but if you feel upset about something, just feel free to come and talk, and we'll see how that goes. So I think it's about that. And it's about also telling the employee that, you know, like Suzanne said, the whole thing of being stoic, that I think true resilience is not about being stoic or saying that I can cope with this, but to know when you should ask for help. And I think that is the messaging which should go. Know when you should ask for help. Don't be shy of asking for help. And I think if leaders can, you know, talk about that and give that as a message, to me, that would be the most important thing.
Thank you, Dr. Prabha. I think I'll have the final question for Jaya, because she's the one on the ground in the trenches, if I may say, because you are living that situation on a daily basis and trying to address that in the organizations. How optimistic are you about the future in terms of what changes need to happen? And are you happy about the changes, about the discussions that are getting generated on this subject, kind of innovation that are happening among organizations? Are organizations taking lead in doing something here, Jaya? A quick answer on this, because I think we are also running out of time.
Sure. Thank you. Thank you for that question, Manoj. And in addition to all the wellness conversations, the webinars, the self-assessments, the employee assistance programs that we're offering, we're the first in India to launch the domestic violence policy, where we're providing a very structured approach and providing a support system for anyone facing domestic violence. And I think this is a conversation that will build. I also believe that this is the right way to go. We've created a support network. We're providing leave. We're also providing the opportunity to relocate to one of our other offices. And I think that we're on the right, we've started off right, and we have lots more to do in this space as we move along. Interestingly, also, if I look back at what our women are asking for, women who have children below the age of 5 are asking to continue to work from home, or those who have elder care responsibilities are asking again, to work from home for longer periods of time. So I think that the pandemic has shifted and changed just the way we look at work, think about the workplace. But organizations will step up and I can see around me as well, they are stepping up to the needs and the ever-changing sort of turbulent environment that we find ourselves in.
Thank you. And we come to the end of this discussion. And thank you so much, Suzanne, Dr. Prabha, and Jaya. Some very insightful and thought-provoking point of views here from the experts. And I'm going to now open the floor for questions. And I can see that a few questions have started coming in. So let's just take a few questions. I think we have time for a couple of them. So the first question I can see here on the chat box is, in practical terms, how can workplaces support women and their mental health? So Jaya, would you want to bring up some of your experiences?
So I think, going back to the conversation we just had with Suzanne and Dr. Prabha, I think just making that conversation safe, ensuring that we can equip our people to respond to the situation. So you definitely need, an expert to help you. But at least the first conversation that you have with either your manager or your talent individual that's working with you, they need to understand how to respond to this as a first responder when you're actually coming up at work and discussing this issue. So I do believe that just educating our people, ensuring that the ecosystem and support system is there for anyone facing this kind of a situation, in terms of just mental health awareness, I think that will help and go a long way.
Certainly. The next question is, I think I should bring it up for Suzanne. What value do you give to internal women's networks? Are they helping women with their mental health issues in Japan, Suzanne?
Can I answer a slightly different way? I have that on my list as one of the things that could be leveraged more to help women in Japan or women anywhere. And not just women's networks. I think, any of the employee resource groups or networks could be leveraged to help have some listening sessions for their targeted group to understand, are there any unique needs for that group? And so, yes, I believe that women's networks can be providing that. I do know that some organizations, their women's networks are having some events, but it tends to be more kind of, happy hour drinks together and sharing a little bit of their stresses or some funny stories about little things that niggle them at home. And I think that the networks could be leveraged a lot more and have some confidential listening sessions. And as Jaya says, for that, you'd need somebody with the professional qualifications to facilitate the discussion. But I think that would certainly be a good way to go.
Thank you, Suzanne. Oh, we have a very interesting question here. I am so happy that this has been raised. And Dr. Prabha, I'm going to bring this up for you. Do you think a solution is to educate men? Can that happen in the workforce?
Yeah, I think that's a great question, and something that we found in our work, that one of the strongest predictors of a woman's mental health is the kind of support that she's getting from her partner. And not just support in terms of emotional support, but I think sharing of the burden, particularly of childcare and of household duties, and sort of trying to get out of that whole traditional mindset of what the man can do and what the woman can do, particularly when women are doing non-traditional work, have non-traditional work roles. So I completely agree that it's important. We've also recognized that for a man to be supportive of a woman, his mental health is equally important. So I keep saying that, for women's mental health, the men's mental health is important. So I think it's about also acknowledging to men that it's okay to say that you're not feeling all right. It's okay to talk about emotions. you're not weak if you talk about emotions or share things with your wife or tell her that you've had a bad day, you're feeling stressed out, you need some space, and sort of, having that channel of communication open rather than being very rigid in thinking and not talking about mental health. Um, it's also about men not assuming that women are the weaker sex, and recognizing that both genders have their strengths in handling different kinds of roles, and being able to switch roles when it is necessary, depending on each person's strengths and weaknesses. So I think you're absolutely right. And this question is a great question, that men's role in women's mental health is very important. Having said that, I think women often tend to gravitate towards each other for support. And, I think that's a much stronger kind of network which works for women, because peer support is one key way of improving your mental health.
Thank you, Dr. Prabha. So we have one more question come up here on a chat box, and this is an interesting one also, which talks about the need to focus on the culture of the organization. And Jaya, I think it would be nice to collect your views on it. How do culture and the kind of definition we have for culture in an organization would help women to address challenges around their mental health issues?
Great question, Manoj. And I think that I'm not only referring to EY here. I mean, as EY, we have a very strong culture of empathy, of empowerment, of, building that stronger culture where people are empowered to choose their time wisely. So whether it comes to meetings, being able to say no for a meeting that at a time that doesn't work for them, being able to block out a lunch break because they need that time to just maybe manage lunch for their large family, or even for take care of their young ones. I also think that utilizing your leave. So utilizing your leave is something we're encouraging. We're trying to ensure that we're building further and higher trust in teams to avoid micromanagement. Also, the concept of belonging is something we're heavily focused on. We're saying that, inclusive leadership and belonging, very, very interconnected. And we're ensuring that, the higher the sense of belonging, the more inclusive you are in your behavior. Also, if I look at our culture survey results and assessments, 93% or 94% of our people speak up, or, are free also to be themselves. And I think these are important levers in just the mental health, mental awareness that people, when we talk about this, how does this really, correlate to well-being? So I think these are important. Sort of the culture is very important, whether you're small, whether you're a large organization like ours. I think building that culture and strengthening that culture is important to ensure that our people are empowered.
And that's all the time we have for the questions. And thank you so much for bringing them up on our chat box. That also brings us to the end of this panel discussion on women in Asia and the challenge of mental health. Thank you, Suzanne, Dr. Prabha, and Jaya, for joining us today and sharing your valuable inputs. Thank you, This Can Happen in Community Business, for organizing such a wonderful event on the crucial subject, particularly, that will increasingly get into the employee well-being strategies of corporates in the coming years. Thank you all for joining in. I encourage you to join us in the next session, which starts on the hour and is titled In the Shadows, Substance Abuse in the Asian Workplace and the Link with Mental Health. Thank you so much.